In this video today, we're going to talk about telemedicine and what is the nitty-gritty details, how to understand it as a patient, how it can benefit you, and why it's easier than you think. Stay tuned.
Cutting Edge Pain Relief, the channel that teaches you how to biohack your pain and get back to doing what you love.
You don't need to be a computer whiz. You don't need to be super fancy in terms of being able to utilize this. If you can flick on a button to a computer or to a phone, you very well can be talked through how to be able to communicate and how to get information across. So the fact of the matter is a number of other concerns from patients are, well, you can't do a physical examination. How can you really be able to understand what's going on with me? Now, let's be clear. There are limitations to telemedicine, at least currently. We know that we can't be able to palpate, meaning touch and press, the same way as what you could do if you were present. But there are things that you can do, even virtually, if you're creative. We can be able to have patients remotely stand. We can see what your range of motion is. We can see what your strength is by you holding various different items, by you pressing against your own hand, see what your range of motion is, talk to you about your sensation in your hand and whether it's altered at all. We can be able to do some examination of your eyes and your other elements of your face by doing just a traditional visual inspection. However, where this really comes to pass is when we start looking at more interesting technologies that can be leveraged to give us a more robust picture. And this is where things become interesting.
So, there's a recent article in the New England Journal of Medicine from March 11, 2020, that talked about virtually perfect or telemedicine for COVID-19. In that context, it talked about how to be able to assess patients, keeping them safe and keeping healthcare workers safe as well. And in looking at the article, it talks about how to be able to triage patients, meaning how to be able to select them accordingly, but also how this can be utilized in a different context. And one of the things that they talked about is telemedicine, as it starts to grow further and further, is this approach has been explored most fully in the context of stroke, for which systems such as Jefferson Health, Cleveland Clinic, and University of Pittsburgh provide virtual emergency neurologic care at large number of hospitals. The Mount Sinai system leverages specialists at 8 different hospitals and more than 300 sites to be able to provide virtual emergency care, consultations, and distribute work among subspecialty providers.
So consider this. Consider the aspect of you being able to get some of the best doctors to be able to help your case. Is it not worth the inconvenience of learning something new? I would say that it certainly is. And as we talk about something new, let's talk about the push for other things that may be coming down the road, which is incredibly interesting.
Some of the most interesting elements of understanding is that aspect of how companies can coordinate together to be able to bring better care. And one of the things that we're able to see is that of companies that are in different sectors be able to provide a more robust solution. So if you look in the column on the left-hand side, you can see that there are a number of different companies that allow for video conferencing, meaning the elements of being able to see the patient and the doctor on video, and you get to talk to one another. So the simple things that are probably easy to be able to recognize are going to be things like Skype for Business or GoToMeeting.com. However, there are other companies like Doxy.me, which is pretty common, or the elements of things like VC or possibly Zoom. And we look to see how is this coordinating with other aspects. So for instance, there are peripheral devices that can be shipped to the patient or bought by the patient, and they can be used to give the doctor real-time information. So things like Echo, which is a stethoscope that the patient places on their chest, and electronically the information is sent to the physician so they can be able to understand what's going on with the heart. How does it sound? What's the potential rhythm that's associated with it? For other companies, they have things like an otoscope where you look in the element of the ear and you can be able to have an understanding about what's going on with the aspect of the ear. They have other companies that have various different cameras and other elements that can be able to connect to show what that physical exam really kind of looks like.
Look at telemedicine and the value that it can definitely bring to both patients, healthcare systems, and providers. We know that it's not a perfect solution, but we do know that it can be able to help fill a gap, help people, keep them safe, provide care, and be able to give them a better experience at times than what we could from just a brick and mortar healthcare experience alone. So, as we try to find ways to be able to make this easier for everyone involved, consider that there are benefits and it's not going to be as difficult as what you might think. If this video provided value to you, please hit the subscribe button for more videos on how to be able to biohack your pain and be able to live a more fuller life. Please stay tuned to our channel and continue to follow us. Take care and have a great day.